Sending your case to an outside lab isn't a clinical standard. It's a choice practices make for themselves, not for you. I'm Dr. Madanese, and I've had over 2,000 full arch cases over the years. By the end of this video, you'll know exactly what the model actually costs you and how to tell which one is right for you. For the first part of my career, the model I used to look like this. A patient came in, we did the planning and placed the implants. Then the case went to an outside lab. The design work, the teeth, the final result. The lab made the teeth. We placed them. If something needed fixing, it went back to the lab, and we waited. That felt normal because it had been the standard for decades. The tools to design and make teeth in house hadn't existed at the practice level until recently. So splitting the work between surgeon and lab became the default. Every field in medicine uses referrals and outside help. On paper, dividing the work looked like a reasonable way to run things. The split model felt like a fair way to divide the work right up until I started watching what patients were actually going through. A patient has surgery. They get temporary teeth that day, and that part goes fine. Then they wait for the permanent set. The case goes to the lab. The lab makes a set. It comes back. Then something about the bite is off. It goes back. The patient stays in temporaries for a few more weeks. It comes back with a different problem, and it goes back again. The patient has no clear answer for who's in charge of fixing it. The surgeon did the surgery, the lab made the teeth, and neither side owned what happened in between. What I kept seeing were patients who thought the hard part was over. Months later, they were still moving between appointments, waiting on the lab, not sure if what they were going through was normal. And most of them were being patient about it. They'd accepted that this was just how the process went. Nobody had told them that it didn't have to. That's the part I couldn't keep ignoring. The delays, the remakes, the confusion over who's responsible. None of that had to happen. The patients were carrying the cost of a system built around what was easy for the practice. The process was failing them, one handoff at a time, and most of them were too patient to say so. If this is landing for you, subscribe before you keep watching. This series is built for the patient who wants to understand how the system actually works before they're inside it. How to tell whether this has been your experience. Has your care been split across more than one office? And do you know for sure who is responsible for your final result? When you've had a question during treatment, was it clear who to call and whether that person can actually fix it? Have you been in temporary teeth longer than you were told? And do you know why and who caused the delay? If something about your final result needed to change, do you know what fixing it would look like and where it would happen and how long it would take? If any of those don't have a clear answer, you've been in a model built around the practice's needs, not yours. The split model is a workflow choice, not a medical standard. Once I understood that clearly enough, staying inside it stopped being an option. What I built is a single practice where every part of the full arch process happens under one roof with one team. That includes the scan, the digital plan, the surgery, making both the temporary and the final teeth in-house, and every follow-up. There's one person responsible from the day someone walks in through the day they leave with their permanent teeth. The reason this matters isn't speed, though it does cut the timeline. When the same team that planned the surgery also made the teeth, there's no one else to point to when something needs fixing, when something needs to change. It happens in the same building, often the same day, by the same people who built it. The same team owns every step, so there's full accountability. When I decided to do this for my own family, including my grandfather and my mother-in-law, I wanted every decision to belong to me and my team with no exceptions. That only works in a model where everything is in one place from the start. Stop assuming a split treatment model is a standard you have no say in. It's a business decision. The practices that choose differently exist, and the experience inside them is completely different. Before you book a consult, ask whether the practice handles every part of the process in-house. Ask that question first, not as a formality, but as the thing that shapes every other part of your experience. When I started asking whether I'd accept this model for someone I love, the answer told me exactly what I needed to build. Here's what that means for the decision you're making right now. The most useful thing you can do before choosing a practice is find out whether they do everything in-house or split your care across outside providers. That one answer shapes your timeline, who's responsible for your outcome, and what happens when something needs to be fixed. Before your next consult, do this. The question to ask every practice you're looking at. Does your team handle every part of the process in-house, including making the teeth? Or does any part go to an outside lab or different provider? A clear answer sounds like everything is done here. A surgeon plans the case, our team designs the teeth, we make them on site, and you stay with us through the final result and all follow up. That practice controls the whole process. A vague answer sounds like we work with excellent lab partners or we coordinate with specialists to get you the best care. Those answers describe a split model. The phrase lab partners means the teeth leave the building. If the answer describes a split model, ask one more question. If my teeth need to be adjusted after the final result, what does that process look like? In an in-house model, the answer is simple. In a lab-dependent model, the answer involves shipping, wait times, and starting over. That answer tells you what your experience there will look like. The model I used to work in felt like the standard because it was everywhere. It still is. But a model being common doesn't mean it's built around the patient. What I built came from watching too many people carry the costs of a process that didn't have to work that way. If you're choosing where to get this treatment, you're allowed to ask whether the practice made the same decision I did, or whether they're still sending your case to an outside lab. If you want to understand the specific mechanics of what happens when a practice sends your case to an outside lab, including what the patient actually goes through, where the accountability breaks down, and the exact questions that tell you which model you're in before you sign anything, there's a video on this channel called What Most Implant Dentists Will Never Tell You About Why They Send Your Case to an Outside Lab. The link is on the screen now.